Hi guys, this is me Gayatri Prakash and welcome to my
page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today I would like to discuss with you all about how to write a letter to an occupational therapist. Okay, so what is the job description of occupational therapist? Occupational therapist is a person who will assess the patient, workplace and also the living place. For example, if a patient admitted in the hospital due to the hip replacement following a fall. So now the patient is ready to be discharged. Thereby, as a nurse, we are just concerning about the patient workplace or a living place. So how exactly the place is safe enough to live and the workplace is safe enough to work, and how about the workplace environmental and living place environmental. So everything has to be assessed to avoid the future occurrence of the fall. Okay, so for that purpose, a nurse is writing a letter to an occupational therapist to do an assessment on patient workplace as well as the living place. So this is the occupational therapist job description. So what exactly the occupational therapist will do? For example, if you are writing a letter to assess the patient workplace, as the patient admitted because of the back pain and it is a chronic back pain, and the patient is working as a forklifter, heavy weight forklifter, and the work is really stressful, and also the work environmental is making him to work a lot, and he has to sometimes lift a heavy objects at workplace. So because of that, it is bothering his back, and also he is suffering with the chronic back pain. He is coming to the nurse to the community health center. So thereby the community health center wondering how exactly the workplace is. Either the patient is working hard or the patient is lifting a heavy objects even after giving the medications like naproxen, brufen, and also patient is on a paracetamol for the pain. So after done this, also patient is currently visiting the community nurse just for the back pain treatment. So that's why the community nurse is just asking an occupational therapist to do an assessment, workplace assessment. So what exactly the occupational therapist will do? They will go to the patient workplace and they will just assess the patient 24 hours, that how exactly the patient is working and what is his job and what kind of the objects that he is lifting and how much kg of that object that he is lifting, and how often he is taking rest while he is working, what kind of the posture, which means the position and posture, body posture that he is maintaining, and how about the work environmental, is that safe enough for the patient to work. So these are the things will be assessed by an occupational therapist. And as per the patient's needs, occupational therapist will help the patient to get assistive devices to prevent the back pain. For example, if the patient's wearing the belt while they are bending, while they are just lifting an objects from the floor, so thereby if they are wearing a belt, that will support their spine and it will help them to relieve the pain. So that will be arranged by an occupational therapist, and also the occupational therapist will teach them how to use it. So this is the exact job description of an occupational therapist when they are doing an assessment on workplace of the patient. At the same time, what is the job description of the occupational therapist when the patient is going back to the home, as the patient was admitted due to the fall and he just undergone for a hip replacement surgery. So now the patient is set to be discharged. The occupational therapist will do the complete home hazard assessment of the patient. So the occupational therapist will go to the patient house, and the occupational therapist will do a complete home hazard assessment. How about the patient room, and what is the patient like, how about the floor, and what is the patient house, either patient is living upstairs or either patient living in the ground floor, and either patient is having the safe floor to walk, and what about the mattress, rugs, carpets, either the patient is having bed rails, and how about the toilet, patient is having holding bars and alarms, pull cord alarm system, raised toilet sheet, and patient is using any reacher to get the things from one place to another place, and also how about the sofas, and how about the furnitures, either they are all having a sharp edges furnitures, and either the patient is using any pull cord alarm system. How about the lightenings in the room, like either it is a bright light or the dull lights. So these all entire assessment will be done by an occupational therapist, and it is their job to make a safe environmental so that they will make a customized room for them. For example, if the patient is not having a proper floor and if the floor is like a slippery floor, so what they will do, they will just put the carpets or rugs, sensory alarm mats, and non-slippery mats, and then also they will arrange all the furnitures will be exchanged with the non sharp edge furnitures, and also also the occupational therapist will help them to use the reachers. Reachers is a kind of a stick. You can just catch the things from one place to another place. For example, if I'm sitting here, by using the reacher I can grab the thing and I can just take it myself. So instead of standing and walking and going getting the things, so because elderly people it is difficult for them, so thereby while they are doing, there may be a chance to get fall. So these all are things will be customized for by an occupational therapist for the patient safety. So this is the exact job description. But one thing we have to remember, job occupational therapist will never ever do the dressing, change the wound dressing, will never ever do household chores works, and also they will not arrange any appointments, and they will not provide any dietary advice. They won't provide any exercise advice, and they won't give any medication to the patient, because they are an occupational therapist just to assess the patient environmental and it is safe enough to live, and also to prevent the risk factors of falling, and also for the safety purpose of the patient and the workplace as well as the living place. And also if the patient needs anything like assistive devices, walker, four-wheelie walker, and also reacher, and also like supportive belts, so these all other things will be arranged by an occupational therapist, that will be teach by an occupational therapist how to use it to the patient. Okay, so this is the exact job description of the occupational therapist. So now for them how to write an introduction. So for writing an occupational therapist, main thing is we need to know a patient full name as usual, and also we need to know a diagnosis of the patient and what is the purpose. Purpose is the main thing. Purpose, for example, if the patient is getting discharged and going back to home, which means you can make a purpose like this, like I am writing to refer. For example, I am just saying I'm writing to refer Mr. X, who is recovering from hip replacement surgery following a fall, full stop, and requires, so now we are writing a letter to an occupational therapist. So purpose is like she or he requires a complete home hazard assessment from your side. So from your side they need a complete home hazard assessment. For what purpose? To make a safe environmental to live, and also to prevent the future risk of fall. That's it. So what you will write in present medical history paragraph. Present medical history paragraph, nothing to be worried of writing in a medication and post-operative complications. That is not necessary for them, because they are not going to do anything with that. So just writing patient was admitted to hospital so and so day, and has undergone the above mentioned surgery on this day, and post-operative period was successful, and the patient managed with adequate treatment and procedures. That's it, enough, and the patient is getting discharged on this day. And now in the social background history, it is very important. Patient is living where, and how about the room, and does the patient is using any assistive devices, and either patient is living in the two-story house, or either patient is living in the upstairs or in the ground floor. So that and all details is very much important for an occupational therapist to know about it. Okay, and also if the patient is having any bright light systems in the rooms, and what about the living area, and how about the things, and what kind of the assistive devices, either patient is using walking stick or frame or anything like that. So these all things has to be explained in your social background. In the recommendation paragraph, if they have given in your chart, like in your recommendation paragraph, in your case note, if they have given, the occupational therapist will do a complete home hazard assessment, and also they will arrange the things like, for example, the bright light system and pull cord alarm system, holding bars in the toilet, raised toilet sheet. So these and all things will be done by an occupational therapist only. So if these points will be there in the discharge advice, please try to write that one rather than writing the dressing, exercise, physiotherapy and medication, because these and all is none of their business. So this are not included the occupational therapist job description. If it is a workplace, for example, if you are asking a occupational therapist to do a workplace assessment, so you can write it in the introduction, Mr. X, who is suffering from, or who has been suffering from chronic back pain or severe back pain, full stop, he requires your workplace assessment. She requires your workplace assessment to safe enough to work. Then you are coming to the present medical history. So for example, if it is a visiting letter, for example, it's a referral kind of thing, a letter, patient is visiting multiple visitors. So you can write patient has been under my care since these many days, and further due to chronic back pain he was treated with so and so medications. However, patient still has problem in still has a back pain, and he unable to concentrate on his work, and he unable to sit for a long time like that. This all the information has been written in your present medical history paragraph. When you are coming to the social paragraph, it is very important to write detailing about his workplace, what kind of the job he is doing, and how far either it is a shift work or it is a long work. And also you have to write either it is like what, how if he is lifting any heavy objects, that how many pounds of that weight like he is lifting, and how often he is working in a week. And this all the history has to be detailedly explained in the social background paragraph. In the recommendation paragraph, we are just advising them to do an workplace assessment and advise the patient to take a break in between his work, and just also make sure that he is not lifting heavy objects from the floor. So these are the things like we are just explaining. If the patient needs any belt to support their spine, and also just make sure that what kind of the posture that he is maintaining while he is doing his job. So these are all things we are advising in the recommendation paragraph for the occupational therapist to do for the patient. So occupational therapist is the person is not a occupational therapist is not a person who will not administer the medicine, who will not do the wound dressing, who will not teach them the exercise, and who will not teach them who will not take them appointment, who will not arrange the housekeeping chores and also home visits. This and all will not be done by an occupational therapist. Occupational therapist is a person who is assessing a patient workplace, either the living place, it is safe enough to live for them, are the rooms and the workplace is customized to them, is there any necessary to prevent the risk of occupational related health issues. So these are all things only will be assessed by an occupational therapist. So I hope you all got a clear knowledge regarding how to write a letter, what are the points very important for the occupational therapist and which is related to the occupational therapist. Okay, and to whomever wants to join in our class, you can contact us at any time, and our number has given in our description. We have 40 days, 30 days, and mock batch and crash course also is ongoing. And also for the beginners, we are just running the classes, and also we are taking separately writing, listening, reading, speaking also, and writing and speaking. Whomever wants to concentrate more, give more important, you can also contact us. So until then, bye bye.